good morning, or rather good day, and welcome to today's Anyoha's podcast. Today's podcast is very special because I'm recording from Africa and I want to draw down to the details. I am recording from Onitsha, which is an urban town in Anambra State, Nigeria. So our time here is actually 1:19 p.m. Today's topic is going to be about hand, foot, and mouth disease. Hand, foot, and mouth disease is the topic for today's podcast, and I've got into this very late because just a few weeks ago I saw many cases of kids coming to the clinic with rashes on their palms, on the soles of their foot, and also in their mouth, tongue, buccal mucosa. So rashes on the palms, soles of feet, and buccal mucosa, and symptomatic or suggestive of what we call disease. If you're a parent, you may have known one or two kids who were affected, or maybe some of you kids were affected by hand. But the story of this disease that is caused by a virus called Coxsackie virus. Coxsackie virus, different strains of Coxsackie virus, but generally speaking, Coxsackie virus tend to cause hand and mouth disease, and it occurs in infants and children, and mostly toddlers, kids between age 1 and 2, 3, but mostly children, I would say in general. The smallest kid I saw with hand, foot, and mouth this season, this epidemic, is a 6 months old, probably 8 months old, with hand, foot, and mouth disease. But this kid, his symptoms were exaggerated, and he had blisters, fingers, and also on the palms, and vesicular rashes on the palm and soles of his feet. That was the youngest infant I saw this year with mouth. And this hand, foot, and mouth tend to occur, like I said, this time of the year, at least in the United States, usually between June and October, the summertime. And this virus is transmitted through fecal oral routes, respiratory routes, as well as special pus. And in fact, one parent told me that she thinks that what's causing it is kids going to the swimming pool and spreading virus cells. So fecal contaminate and can get into kids' mouth and cause hand, foot, and mouth. It causes simple rashes on the palms, like I said, out and on the mouth. So fecal contamination, contaminated water with the virus through swimming pool, when kids are there, because the weather is hot and a lot of kids are on vacation. They want to go and have fun in a pool, and perhaps a child who has rashes would spread the rashes, would spread the virus among the other kids. Or a child who's harboring the virus stool could contaminate the water and pass it to other kids. That's how kids get that from swimming pool, and that's what his mother was having. So we saw so many kids with hand, foot, and mouth this July, a month ago, or weeks ago. It's kind of trying to taper off in the United States, but going back by trends, there will be another epidemics or the rise of the symptoms of Coxsackie virus, hand, foot, and mouth in October. So we will be anticipating this resurgence of virus in October, but it has tapered down. I don't see. A week ago, just saw one case or a couple of cases, so it's tapering down, but you still see some cases. So we've gone through the symptoms, which is mostly rashes on the palms of the hand, rashes on the soles of the feet, and some sores over the tongue or the inside of the mouth, or we call the buccal mucosa. And sometimes the children will have slight fever. They might have cold, runny nose, cough, but not much. And the rashes don't tend to be itchy, but some kids who have low threshold may not want to eat because of the painful rash at tongue and their throat. So kids who are picky eaters to start with, or who have low threshold, are not eating, might become dehydrated. So what is the treatment? The treatment is just to observe. There's no antibiotics needed for these rashes. The rashes tend to go away in 7 to 10 days. It dries and goes away. So there's no need for antibiotics measures we give are what we call palliative measures. If the child has fever, you give him something for fever. You give him or her something for fever like Tylenol or Motrin for fever. If they're itching, usually the rash don't tend to pruritic, but if the child is itching, you can get some calamine lotion or over her body and reassure her. And of course, we monitor for fluid intake, encourage fluid intake, especially kids who don't want to drink. Encourage them to take some soft pudding, jello, soup until lesion be dry. So this is basically what hand and mouth disease comes every year. It surges every year and it goes away. And most parents are aware of it, and sometimes they make diagnosis before they come to the office, to the clinic, and they want reassurance from the clinic. Sometimes, occasionally, you can have complications, especially for kids who are immunocompromised or have low immunity. Viruses can spread in the brain and cause encephalitis or brain issues, but I've not seen that happen in practice. But that is a very essential component. Our prevention is, of course, to exclude a child who has lesions, who has rashes, exclude them. The rest of the kid, temporary exclusion from daycare or from school until the rashes dry up and disappear. So that's the prevention. Of course, to avoid overcrowding. In poor countries, overcrowding could be a potential cause, a risk for spreading hand-mouth disease. Some people think instead of calling this hand, foot, and mouth disease, it should be called hand, mouth, and buttock disease, because a lot of kids have rashes, similar rashes that they have on their palm, foot, also over their buttock. So don't be alarmed if you see rashes over the buttock area, around the mouth area, on the tongue, on the palms, and source of foot. So this is hand, foot, and mouth disease, and most kids get over it and become healthy and then go to school. So thank you so much for listening, and please share this podcast with friends and family, especially when it's coming from motherland Africa, Nigeria, and specifically Onitsha, where I was born. Thank you so much. I'm so happy to be podcasting from Onitsha. Thank you. Still on hand, foot, and mouth disease, part of prevention is adequate hand washing. Kids are supposed to wash their hands. Adults are supposed to wash their hands frequently, especially if they're exposed to contaminated areas, objects, or if they have been in public places. When they come home, they should wash their hands and take a shower. This is one way of preventing transmission and spread of Coxsackie virus disease. Also, another way of preventing the spread is to disinfect contaminated areas like daycare, schools. When there's an outbreak, those areas have to be disinfected using a professional disinfectant that works. So prevention is a big part of it. And also, in cases where a child becomes really very sick, they should be hospitalized, as a matter of fact, and given adequate care, including sometimes specialized therapies like immunoglobulin. Even though this is a very benign disease, parents and clinicians should always be on the lookout for that child who might have complications, or that child who might have a severe infection and warrant admission into the hospital and further management. Thank you so much again. This is Dr. Anyoha.